head trauma or head injury. Okay, so I'm going to do head trauma and head injury right now. The investigation of choice for any kind of head injury is NCCT. ठीक? Because whenever head injury takes place, we are not going to go for contrast, because when we are going to put contrast, it is going to land up the person even more in a compensated state. What are the indications for non-contrast CT head? ग्लासगो कोमा स्केल जिसका 3-13 से कम हो जाए, ठीक, 13 से कम होगा, सो दैट इज़ एन इंडिकेशन, या फिर 13 से 14 रहे फॉर अ पीरियड ऑफ 2 आवर्स, या फिर there is a fracture in the skull, or if there is any kind of neural deficit, then age of the person more than 65 years. If a person is more than 65 years of age, in that case also we are going to go for NCCT. Okay, then amnesia. Amnesia for more than 30 minutes, in that case also head injury. In that case, that is also an indication for non-contrast CT. And the next is the seizures. So these are the indications when you have to take the CT. If a person says that he is not able to recall anything for more than 30 minutes, in that case, that becomes an indication for CT. Okay. Vomiting. Vomiting, more than 2 episodes of vomiting is considered as an indication. Just 2 episodes of vomiting. Or by any dangerous weapon injury. Any kind of dangerous weapon injury uh, will also serve as an indication for non-contrast CT. Now, Glasgow Coma Scale. Glasgow Coma Scale, it is the assessment of the best clinical response to eyeball, verbal, and motor system. So, EVM. EVM. We know that EVM is actually 4, 5, and 6. That is the score. But it's important to go into the details of this. First is response to eye opening. It is same for infants and adults, and that is spontaneous eye opening is 4. To command, when you are being called, when somebody calls out your name, in that case it is 3. To pain, winces in pain or cries in pain, in that case the eye opening will be 2, and if there is no response, that will be 1. There is nothing called as 0. Then comes EV, then verbal. Verbal is oriented 5, whereas in pediatric we call it age appropriate vocalization and smile. Confusion. Confusion, in case of confusion, confused, looks confused, he appears confused, it has to be 4. Look for this word. Particular word that you have to look for is the word confusion. Then it is he cries and it is irritable. He cries and he or she is irritable. In that case, the score will be 4. Then inappropriate speech, yeah, incomplete sentences. In that case, it is 3. Cries to pain. Cries to pain will be 3. Incomprehensible speech, yeah, sound will be 2. And moans to pain, it will be the same thing. No response is 1. Abuse is considered incomprehensible, that is 2. Okay. Now, uh, motor response. Motor response is the best predictor of the neurological outcome. So, score for best motor response is considered if it is given for 2 different limbs. So, any 2 different limbs, so we are going to consider the score that is best in that. If somebody obeys the command, like 6 has to be the score. move spontaneously and also purposefully, the score is going to be 6. Then, if the person localizes pain, in case the person is going to localize pain, it has to be 5. Okay, like obeys the command, localizes pain, has to be 5. Then, um, for children, it will be withdraws to touch. Withdraws to touch is 5. Then, withdrawal to flexion or withdrawal to pain will be 4. Okay, and same will be for pediatric patient as well. But for flexion is abnormal or decorticate posturing, it will come in 3. Decerebrate or extension posture will amount to the score of 2, and no response will amount to a score of 1. Okay, what is the maximum GCS? Maximum GCS is 15 on 15, whereas minimum has to be 8. Minimum has to be not 8, minimum has to be 3. Dead is not applicable here. Brain dead is at 3. In case of modification, what is the modification? Example is ET tube ka intubation or tracheostomy. That is the only modification. What is the new rule? We need to add the suffix nt to modified component. For example, nt means not no not stable, or you can say it cannot be calculated. Add score of 1 along with the modifier. That was an old criteria, it's no longer done. Now GCSP score. In GCSP score we are going to do GCS minus P, and that will give us the score, where P stands for the pupillary response. If both the pupils are dilating, we are going to give the response of 2. We are going to give the score of 2. If only one is responding, we are going to give 1. If none of them responds, then the score will be 0. So 2, 1, 0. 2, 1, 0 is the score. So pupillary score is subtracted from the GCS to give the final value. So the range will be from 1 to 15. Classification of head injury on the basis of GCS. On the basis of this GCS, minor, mild, moderate, severe. Okay, minor, mild, moderate, severe. Minor is what? When there is no change in the GCS. Okay, mild, in mild it can be from 14 to 13. 13 with history of loss of consciousness also. Moderate is from 9 to 13. 9 to 13 is moderate, whereas 3 to 8 is severe. Less than 8 is considered to be the patient is in coma. What are the other scores? There is some score called as Glasgow outcome score. It's very important. The grading of outcome का मतलब क्या है? How somebody has, if somebody has recovered, then what is the outcome of a particular procedure that helped the patient to recover? So outcome is for the recovery. Okay, if the outcome is good, then that means the score has to be 5. Moderate deficit 4, severe deficit 3, persistent vegetative state या state of coma is 2. Persistent vegetative state or state of coma is 2, and 1 is for death. So 1 it means क्या हो गया? Somebody is dying or there is death. Persistent vegetative state or state of coma. Good. Moderate deficit, severe deficit, persistent vegetative state or state of coma. Okay. And death. These are the 5 things. Persistent vegetative state or state of coma. रिवाइज ट्रॉमा स्कोर, इसमें जीसीएस होता है, इसमें बीपी होता है, एंड यू ऑल्सो हैव रेस्पिरेटरी रेट. ओके, हार्ट रेट या पल्स रेट इज नॉट टेकन इनटू अकाउंट. जस्ट रिमेंबर that in revised trauma score you will have SPP, you will have rate, that is the respiratory rate, respiration, and GCS. Injury severity score is based on anatomy, whereas TRIS, that is trauma and revised injury severity score, is best and trauma score. It is a combination of RDS, that is revised trauma score, so it will have rate, respiration rate, SBP, as well as Glasgow Coma Scale, and it will also tells us about the is the anatomy, and it is going to tell us the age of the patient and also the mode of injury. So Orma was the ट्रिस का वो तो ट्रिस में मोड ऑफ इंजरी पता चलता है. Then mangled extremity severity score, MES, is age, shock, ischemia and energy of impact. Now MES में क्या होता है? In MES it is ELISA. ELISA was the mnemonic for MES, and it means E is for the energy of impact. L is for what? ELISA में एनर्जी ऑफ इम्पैक्ट. एल इज स्मॉल सो वो नहीं कंसिडर करेंगे. आई से इस्चीमिया, एस से शॉक एंड ए से एज. सो एलाइजा. These features helps in calculating the MES. MES is calculated by ELISA. ELISA is energy of impact. Then I, ELISA में L will remain silent. I stands for ischemia. Uh, Ischemia, and another ELISA. S stands for shock and A stands for age. These features helps in calculating the MES. Now types of head injury. Head injury can be primary or it can be secondary. Now time of impact is the only differentiating feature between primary injury and secondary injury. So primary injury or secondary injury में differential feature is the time of impact. If uh, time of impact means if the energy, if the time of impact is what? So time of impact may injury at the time of impact means injury is going to occur at the site, and injury following primary head injury is trauma. So what is this traumatic injury? Primary head injury हुई. So following primary head injury, if something gets injured, in that case it is called as the secondary head injury. So primary head injury is like concussion, contusion, diffuse axonal injury and laceration. Whereas injury following primary head injury includes factors associated with secondary head injury could be hypoxia. हाइपोक्सिया में ऑक्सीजन 8.8 नहीं 8 किलो पास्कल से कम हो जाएगा. A patient generally becomes symptomatic when at 6 kilopascals, but cerebral hypoxia begins around 8. Symptomatic 6 पे होता है, hypoxia 8 पे स्टार्ट हो जाता है. Then hypotension. Hypotension में क्या है? SBP less than 90 mmHg. ठीक. Raised ICT. Raised ICT is critical ICT जो हमने पढ़ा था 20 mmHg अगर हो जाए, या critical is also even less than 60 mmHg, 20 to 60 mmHg we can say. Cerebral perfusion pressure has to reduce. Okay, normally the cerebral perfusion pressure is 70 to 105 mmHg. If this is going to reduce in that case as a result of head injury, then that will amount to a secondary manifestation of a primary injury. Then Electrolyte imbalance can occur, seizures can occur, vomiting can occur, there can be pyrexia, there can be hyperglycemia. Now, traumatic brain injury has there are certain types. This is not based on the time of impact. This is based upon how an injury appears. Like it could be an closed injury, it can be open, it can be certain form of fractures. Okay, so if it is closed injury, closed is the most common variant of head injury where nothing is visible as much on the external surface, but internally there is some sort of injury. Concussion, overall, most common head injury is concussion. Okay, concussion is the most common head injury. Then you have other forms of head injury as contusion, diffuse axonal ischemia, diffuse axonal injury, and penetrating injuries. So concussion, contusion, and diffuse axonal injury, they are actually a part of blunt trauma, while penetrating injuries could be by missile or it can be by non-missile. If it's by missile, then it is called as the gunshot injury. By missile, then it has to be what? Gunshot injury. And non-missile is by a stable knife or an ice pick. So this is not a missile, but it can be by a knife or it can be by a ice prick, even ice prick. ओपन इंजरीज के बारे में कुछ है नहीं, मेनली इट विल बी इन RTA. Fractures of the skull, of the base of the skull, and the craniofacial fracture. Base of the skull fracture is also known as the motorcyclist fracture because it's common in RTA and also especially in the motorcyclists. Now, base of skull fracture. See, this is the skull. Okay, you have anterior cranial fossa, middle and posterior cranial fossa. All this is divided into one third, then one third. So this is the cranial nerve injury. In the anterior, it will be 1 and 2 cranial nerves, mostly 1 more than 2 we can say. Middle cranial fossa is 7, 8th cranial nerve injury, and posterior is 9, 10 and 11, 12. Cribriform plate. Cribriform plate is this plate, or panda eye or raccoon eye is from the anterior cranial fossa fracture. Battle sign or ecchymosis is going to be from the middle cranial fossa fracture, mastoid के पास हो जाएगा. And CSF autoria can also occur as a result of this. Now see, if CSF autoria can occur, then why, मतलब क्या होता है कि from eustachian tube, the CSF from the autoria वाला जो है, from the ear, can come to the nose. Okay, because eustachian tube is going to open into the nasopharynx, oropharynx, and one more, nasopharynx mainly. So CSF rhinorrhea can occur. Okay, this is paradoxical CSF rhinorrhea because actually the CSF rhinorrhea, one which is true CSF rhinorrhea, has to come from anterior cranial fossa, but this one comes from the middle cranial fossa, so that's why it is called paradoxical. Okay, then posterior cranial fossa is associated with 9, 10, 11, 12 cranial nerve involvement. Posterior cranial fossa or posterior 130, 9, 10, 11 and 10, 11, 12. So 9, 10, 11 is also called as the Wernicke syndrome. It is jugular foramen syndrome. Wernicke syndrome is actually jugular foramen syndrome. Wernicke syndrome is jugular foramen syndrome. Wernicke syndrome is jugular foramen syndrome. Okay. Whereas 10th, 11th and 12th will have Collet-Sicard syndrome, which is 10th, 11th, 12th. Paulette Sicard syndrome. Confirmation of CSF is by bedside, a double ring or a halo test. ओके हेलो टेस्ट होगा ब्लड बीच में CSF बाहर यू आर गोइंग टू सी टारगेट साइन कंफर्मेटरी इज बाय बीटा टू ट्रांसपेरेंट मार्कर ऑफ हेड इंजरी इज S100 and apolipoprotein E2. Apolipoprotein E2 is the best. Okay. Then comes the first line treatment. First is the conservation. Conservation में क्या होता है? Lumbar drainage of the CSF. Conservative management is we are going to do lumbar puncture or lumbar drainage of CSF. Now concussion. Concussion is a reversible injury or temporary neurological deficit following blunt trauma. You are going to have amnesia. Amnesia is a hallmark of concussion. Okay. When that what is amnesia? Amnesia is actually forgetfulness. You are going to forget things like we always do. So amnesia is a hallmark. Okay. Now reversible and it takes minutes to hours. Amnesia is a hallmark, it is reversible and it takes minutes to hours. Okay. Uh, yeah. Amnesia is a hallmark of concussion. It takes minutes to hours. There is something called as Colorado grading. So Lundberg grading was for raised ICP. Colorado grading is for concussion. It could be of three types 1, 2, and 3. In the first one, we are going to have confusion. In the second one, we will have amnesia. And in the third one, will have loss of consciousness. What is the mechanism? Electrophysiological alteration is going to cause efflux, maximum efflux of potassium ions, and this is going to cause concussion. Okay, so then there is too much efflux of potassium ions. Okay, and influx 3 sodium outside, potassium inside is going to cause resting membrane potential. Too much efflux means there is a sort of depolarization, and too much depolarization is going to cause concussion or central cortical depression. CT MRI will be normal because only electrophysiological alteration, so judgment is always clinical. So CT MRI in these patients will be normal because only electrophysiological alteration होती है, and so the judgment has to be clinical. High impact trauma हो सकता है reversible या normal, is when you have lucid interval, and there is also a stage of complication. So these are the three stages: high impact, lucid interval, and complication. Coming over to contusion. What is contusion? It's a small bruise associated with blunt trauma, causing crashing of the brain against the bony prominence. So bony prominence जो है उसके against there will be a crash of brain against this bony prominence. Okay, small bruise associated with blunt trauma, causing crashing of the brain against the bony prominences. Okay, this is the coop and this is the coop injury. So what is it? It is a small bruise associated with blunt trauma. Okay. Contusion is basically a bruise associated with blunt trauma. Contracute and coop. Crashing of the brain against bony prominence is one thing. Then comes diffuse axonal injury, DAI. Diffuse axonal injury क्या होती है? It is a traumatic shearing disruption of axons. It is traumatic and it is shearing disruption of axons. Due to sudden rotational acceleration followed by deceleration. CT scan will be normal again. Investigation of choice will be MRI. You are going to see punctate lesions at the corpus callosum more than at the dorsolateral part of the midbrain. So actually you are going to see punctate hemorrhages at the corpus callosum also, and also at the dorsolateral part of midbrain. Best junction of the gray matter with the white matter is the best time when you are going to see this. What is the prognosis? Prognosis of this is poor. Okay. Head injury non-contrast CT karaya, it comes out to be normal. So it can be either concussion or it can be diffuse axonal injury. Now we are going to wait for 6 hours. If it is going to improve, then that means it was concussion. If there is no improvement, in that case it is diffuse axonal injury. Why is it improving? Because there was electrophysiological imbalance, and over a period of time this electrophysiological imbalance gets corrected even by the initial stages of the initial practices of resuscitation. Then comes intracranial hematoma. Okay, intracranial hematoma is of two types: EDH, that is epidural hematoma, or it can be subdural hematoma. Okay, so epidural hematoma or subdural hematoma. What is the site of intracranial hematoma? के two types होते हैं. It is epidural or subdural. What is the site? Site is what? Between the skull and the durameter. So between the skull and the durameter is the site of epidural. So as the name suggests, dura और skull के बीच का. Source of epidural hemorrhages has to be bridging. No, it has to be arterial. Middle meningeal artery is the commonest and terion is the thinnest part that where it occurs. Parenchymal injury to the brain होगी नहीं होगी. What is the impact? How should the impact be? To cause EDH, the impact should be very high impact. Lucid interval. Lucid interval is there in EDH. Okay. Whereas in then whereas in subdural, the site between this it is the site between dura and arachnoid. Okay. SDH is subdural and it is the site between dura mater and arachnoid. Venous venous more than arterial, better within cortical vessels. Venous more than arterial and bridging cortical vessels. Parenchymal injury होती है in subdural hemorrhages. High impact except in elderly, alcoholics and infants. It can be low impact in them. Lucid interval is seen in less than 5% of the patients. Carnohan phenomena. What is this? This is a radiological finding due to the extreme midline shifting of the mass. वो होगा या फिर नहीं होगा. Okay. होगा in what? EDH. Whereas in SDH it will not be there. Investigation of choice दोनों में NCCT. Shape. Biconvex. Concentric is plano-convex. Concentric or plano-convex. What is the management? Management here is it's a kind of surgical emergency. ठीक. ट्रॉमा पूरा करना पड़ेगा. It is a surgical emergency, and management, first line is surgery and then craniotomy. Indications for conservative management is what? When the volume of the clot is less than 30 cc, तब आप conservative management करोगे. Thickness is less than 1.5 centimeters and GCS score is greater than 8. In that case, we are going to go for this. GCS score more than 8. तब conservative management कर सकते हैं. And prognosis is excellent. Whereas for STH, the first line is again conservative. What are the indications for surgery? See, indications for surgery like craniotomy is a clot thickness of more than 1 centimeter. This is in STH. If the median midline shift is more than 5 millimeter. If the fall in GCS is more than 2 post admission. And indication of surgery in chronic SDH is clot thickness more than 1. This is in chronic, and all acute on chronic has to be done by surgery. Prognosis is poor. EDH has 3 stages: stage of concussion, stage of lucid interval, stage of complication. So, what are the stages? Stage of concussion, stage of lucid interval, and stage of complication. 3 stages होते हैं इसके. पहला तो concussion का stage है, that is electrolyte abnormality. Then you will have lucid interval, and then you will have complication. Complication could be in the eye, so you can have Hutchinson pupil. This is ipsilateral fixed and dilated pupil which is not reacting to light. Whereas motor can be contralateral hemiplegia. Complication of ipsilateral cerebral peduncle. Complication of ipsilateral cerebral peduncle is paralysis of the corticospinal tract and contralateral hemiparesis. मोटर में contralateral hemiparesis होता है. Carnohan phenomena is KP. Okay, it's a rare, and it is the compression of Carnohan phenomena is KP. It is what? It is rare. It is the compression of contralateral corticospinal Carnohan phenomena or KP. It is rare. It is a compression of contralateral corticospinal tract against tentorium, leading to ipsilateral hemiparesis. Okay, Carnohan phenomena is called as KP. Okay, it is a rare. It is a compression of the contralateral corticospinal tract against the tentorium, leading to ipsilateral hemiparesis. False localizing sign. This is the hematoma. It will compress the contralateral corticospinal tract, and this is going to lead to ipsilateral hemiparesis. It was seen a lot in this EDH, but less than 55% cases of SDH have Carnohan phenomena. Management is craniotomy. Cranial vault is opened by a bone flap, and it is removed and preserved in abdominoplasty after being stable and removal of hematoma. And removed and preserved. See, bony flap of the head is preserved by abdominoplasty, मतलब पेट में. After being stable and removal of hematoma, cranioplasty is done. Burr hole is actually a diagnostic approach. Burr holes are joint and a trauma flap is made. Burr hole is too small to remove the clot. It is not done nowadays. Okay. Then comes SDH. SDH, this is the arachnoid that is freely movable. Okay. Freely mobile. This is what? This is the थिक आर्टरी, जो कि थिक आर्टरी है, दिस इज द ड्यूरा दैट इज फिक्स्ड. वेन्स जो होती हैं दे आर थिन, और थिक आर्टरी इज BCV. An impact, therefore veins rupture more commonly, and these veins are called as bridging veins. Veins rupture more commonly and are called as bridging veins. Veins rupture more commonly, and these veins are called as bridging veins. Therefore, the veins rupture more commonly, and they are called as bridging veins. Veins rupture more commonly, and they are called as bridging veins. This is pre-existing strain, and this is senile atrophy, so that is going to cause shrinkage of the arachnoid. Veins rupture more commonly, and these veins are called as what? Bridging veins. Bridging veins, they are going to rupture. Okay, this is senile atrophy. Senile atrophy में shrinkage हो जाएगा of the arachnoid. Pre-existing strain है. This is a type of low impact trauma, so lucid interval is not seen. Lucid interval will be seen in only high impact. Now acute on chronic or chronic SDH. SDH for more than 22 weeks. Actually not 20 weeks, 2 weeks. Chronic SDH is surrounded by a membrane that has its own blood supply, so it is called a vascularized membrane. Chronic SDH में repeated trauma of that vascularized membrane होता है, that leads to fresh bleeding, and once fresh bleeding occurs, um, acute on chronic SDH के symptoms आएंगे. Machine oil hematoma is a reddish black in color in elderly, large burr hole more than 2.5 cm in diameter. This helps in removing the hematoma with NEM. Acute is 3 days, subacute is 21, chronic is more than 21 days. Now moving on to spinal trauma. Spinal trauma की बात करते हैं. I think all trauma is important. Most common is what? Cervical spine more than thoracic. Cervical spine is 55%, thoracic is 20%, and thoracic spine is same as lumbar spine, and that is more than sacral spine, that is just 5%. Most common site is between C5 and C6. Most common site is between C5 and C6. Mechanism of injury is hyperflexion, hyperextension, distraction, rotation, and compression. Hyperflexion, hyperextension, distraction, rotation, and compression. Okay. Hyperflexion, hyperextension, distraction, rotation, and compression. Cervical spine में hyperflexion more than hyperextension. Thoracic में lumbar और sacral, इन सब में distraction is the type of injury. Overall hyperflexion, distraction more than hyperflexion. Investigation of choice is NCCT. Best is what? Spinal CT. Best in spine trauma with nerve deficit should be an MRI, but not directly done. First CT scan is done and then MRI is done. And there is a criteria called as the nexus criteria. There is a criteria called as the nexus criteria. Now, what is the indication for urgent CT or X-ray in trauma. It is the this is done for urgent CT करा लो या फिर X-ray in trauma. National Emergency X-ray Utilization Study. National Emergency X-ray Utilization Study. Urgent CT and X-ray in trauma. N is what? N is the neurological deficit. E is ethanol intoxication. Extreme distraction injury and unstable patient. So neurological deficit हो जाएगा. Ethanol का intoxication. Neurological deficit. Ethanol का intoxication. Extreme distraction injury and unstable patient. First is what? X-ray. It is done at bedside. Once the patient is stable, then NCCT. N is what? N is the neurological deficit. E, E, E is ethanol intoxication. X is extreme distraction injury. Extreme distraction injury is this. Neurological deficit, ethanol intoxication, extreme distraction injury, unstable patient. First thing you have to do is X-ray. Done at the bedside. Once the patient is stable, then NCCT is done. Spinal tenderness. It is the most reliable clinical sign of what? Of spinal injury. Management is stabilization of spine, cervical, so a hard collar, Philadelphia collar, thoracic spine, lumbar spine, sacral spine में strapping on the hardboard. This is done for thoracic spine, lumbar spine, and also this sacral spine. Now, what is miscellaneous thing यहाँ पे? Is the examination of spine. We are going to do a log road maneuver in which 4 people are required. Minimum 4 people are required, and spinal tenderness is checked by a log roll maneuver. So minimum 4 people are required. Now neck injury. Neck injury mein there are zones. Now this is the first, the second and third zone. First is what? Sternum. Then you have clavicle. This is the cricoid cartilage that is there. That's the second part, and then there is mandible. That is the third part. Okay. Clavicle is sternum, clavicle, cricoid, mandible. Okay. So first from sternum to cricoid, and from cricoid to the mandible. This is symphysis mentae कह लो, वहाँ से लेकर एक लेवल बनाएंगे, एक लाइन बनाएंगे. That will be the second, and mandible के से लेकर आपका angle of the mandible या इधर वाले एरिया में that will be third. Breach of platysma will be seen in penetrating injury. Stable patient है या नहीं है? If the patient is stable, तो कोई भी no zone approach is used. We are going to do CT scan, CT arteriography, angiography. Injury अगर है तो we are going to angio embolize the patient. But if the patient is unstable, okay, then we will have to do a zone wise approach. For first is the नीचे वाला part, second is mid वाला part, and third is the ऊपर वाला part. So I think the most critical of these will be the second one. So in second one you will do surgery, whereas in case of first and also in the case of third one you are going to do angioembolization, and then you are going to proceed to surgery. Okay, this was about neck trauma. Coming on to trauma, the miscellaneous part, the triage. What is the meaning of the word triage? Triage means to sort, and it is used when demand overrides the supply. So what is triage? Triage means to sort, and it is used when demand overrules the supply. Okay, so concept of triage. What was the concept of triage? We are going to treat the maximum number of people with limited number of resources, and we are going to treat everyone who is requiring the treatment. This is the main concept of triage. Start protocol. it was START protocol is generally followed in a community, and it stands for Simple Triage and Rapid Treatment. START, Simple Triage and Rapid Treatment. This is for community. Now, color coding and the priority status. We know red सबसे ज़्यादा priority highest, so urgent life saving intervention has to be done. Yellow is for uh, is somebody who has high priority, but intervention can be delayed, like requiring intervention but not life saving intervention. So he or she can be treated within 24 hours but not immediately. Green is what? Green is ambulatory patient or low priority patient. Require first aid management is the management required, where black is least, and least means dead or moribund patient. Okay. Expectant management is done in black. Black is the expectant management is done for black priority. This was asked in one of the GTs. And then ambulatory is green, required first aid. Yes. Then blue. Blue means deferred priority, requiring life saving intervention but are deferred due to limited resources. लाइफ सेविंग इंटरवेंशन तो चाहिए, बट दे आर डिफर्ड because we have limited resources. So this is called as deferred priority blue. Missed protocol. What is missed protocol? Missed protocol uh, is for mm, is for hander of the patient information to hospital from disaster site. Handover. So patient की information from to hospital from the disaster site को हैंड ओवर करने के लिए द प्रोटोकॉल दैट इज फॉलोड इज मिस्ड प्रोटोकॉल. फर्स्ट M is for the mechanism of injury. Mechanism of injury, we were getting mechanism of injury in TRIS also. TRIS was an injury severity score भी था, उसमें RTS भी था, उसमें एज भी था और उसमें मिस्ड भी था बिकॉज, और उसमें mechanism of injury भी था बिकॉज उसका जो निमोनिक था वो अर्मा था. अर्मा, where A was age, M was the mechanism of injury, I was injury severity score, and ARMA में R was revised trauma score. So mechanism of injury हो गया. In MIST you are going to do what? Mechanism of injury पता होना चाहिए. The injury is identified, signs at the site and treatment given. This is the four things. तो पहला तो mechanism of injury, जो injury आपने identify कर ली, then you are going to see if there are any signs of that injury at a particular site and the treatment options given. Now patient survey. Patient survey can be primary or secondary survey. Primary survey में resuscitation is done. Resuscitation, primary survey and resuscitation, both these procedures are always done simultaneously but not done as an absolute different procedures or solitary procedures. These are done together, and in the primary survey we are going to do the ATLS protocol. So primary survey as well as resuscitation go hand in hand. Then primary survey में first clinical assessment after stabilization of what? ABC. तो ABC में airway, breathing and circulation. So airway में chest, chin lift, jaw thrust, neck tilt, but head tilt is not done. Head tilt is not done. Neck tilt, jaw thrust, chin lift. Okay, chin lift, jaw thrust, neck tilt. Okay, then cervical spine has to be stabilized by what? Philadelphia collar. Then we are going to do start the assessment of airway, circulation, breathing, disability, exposure. So C, A, B, C, D, E, and C is for what? C is the small c is for controlling any catastrophic breathing. Okay, so this is what primary survey is. Secondary survey is done post hemodynamic stabilization. Once the patient is hemodynamically stable, we are going to do the secondary survey. In secondary survey, the criteria followed is ample criteria. Ample में A stands for allergy. You need to know whether the patient has any allergy or not. If the patient, M stands for medication. If the patient is taking any medicines that, like some anticoagulants or any steroids, etc., that can alter our course of treatment in the long run. So that has to be taken care of. Then past history. Past history may past history could be medical history, or in the same way we are going to take up the pregnancy status as well. So P stands for past history as well as for the pregnancy status. L is the last meal taken. Last meal, because in surgery we need to have the patient nil per oral for most of the surgeries, where you need for clear liquids the fasting stage is 2 hours, whereas for solids it's for 6 hours. Okay. So, okay. So that is it. So allergy, medication, past history is medical, last meal kabli, and the events of trauma. What are the events of trauma? So this is the things that you have to take care of in the second survey. Then comes the thoracic trauma. Thoracic trauma is mainly by deadly dozen. It's a life-threatening. 12 life-threatening conditions. That is why it is called as deadly dozen. It can be 6 hidden, and 6 will be what? 6 will be lethal conditions. What are the lethal or 6 life-threatening conditions? These need to be ruled out in the primary survey itself. This is what: airway injury, tension pneumothorax, open pneumothorax, massive hemothorax, failed chest, and cardiac tamponade, which is a penetrating injury. Okay, so you have atom FC is airway injury, tension pneumothorax, open pneumothorax, massive hemothorax, and FC is what? FC is flail chest. Flail chest या फिर cardiac tamponade. Cardiac tamponade will have penetrating injury. Cardiac tamponade will have penetrating injury. Airway, tension pneumothorax, open pneumothorax, massive pneumothorax, flail chest, and cardiac tamponade or penetrating injury. Okay. Then comes, now there are 6 hidden or 6 life-threatening conditions to be searched for post-stabilization. And what are these life-threatening conditions? Airway injury, tension pneumothorax, open pneumothorax, massive hemothorax, flail chest. Okay. Cardiac tamponade is a penetrating injury. Cardiac tamponade will come in the category of penetrating injury. Now, 6 hidden or 6 life-threatening conditions to be searched for post-stabilization. They are atom PD. Now, this is for post-stabilization. Again, it is atom PD. Aortic injuries, tracheobronchial injuries, aortic, tracheobronchial, esophageal, myocardial injury, and pulmonary injury. Diaphragmatic injury. Pulmonary injury, diaphragmatic injury. Pulmonary injury, diaphragmatic injury. Commotion cardiac, sudden cardiac arrest associated with blunt trauma associated with disruption of the electrical conductivity. Blunt trauma is also associated with disruption of electrical conductivity. Aortic, tracheobronchial injuries, esophageal injuries, myocardial injuries, and pulmonary injuries. These are the injuries. Aortic, tracheobronchial, esophageal, myocardial, pulmonary. These were diaphragmatic injury. Associated with blunt trauma, associated with disruption of electrical conductivity. Airway injury. Most common cause of death in early hours of trauma is the first 24 hours of trauma. Aortic, tracheobronchial, esophageal, myocardial, pulmonary. एंड डी इससे क्या हो जाएगा? डायफ्रैग्मेटिक इंजरी. एयरवे, टेंशन न्यूमोथोरैक्स, ओपन मैसिव flail chest, cardiac tamponade. Most common cause of death is what? Early hours of trauma. में क्या होता है, दैट इज फर्स्ट 24 hours of trauma. Most common cause of death is airway injury. Use ET tube intubation, tracheostomy, cricothyroidotomy. It is preferred in trauma as it is quick. Contraindicated in children as there is a risk of subglottic stenosis. And age less than 12 years, it will be contraindicated. It will be contraindicated in age less than 12 years. फिर आता है टेंशन न्यूमोथोरैक्स. Pneumothorax and plus hypotension, these are the hallmark features. And damage to visceral pleura is what? Injection pleura acts like flutter valve. ठीक. Pneumothorax plus hypotension, these are the two hallmark features. ठीक. Pneumothorax or hypotension, they are the two hallmark features of tension pneumothorax. Okay. टेंशन pneumothorax में hypotension, pneumothorax plus hypotension, these are what? These are hallmark features. Damage to visceral pleura is injection pleura, acts like flutter valve. Okay. Pneumothorax and hypotension. We see this. Collapse of the ipsilateral lung. Respiratory distress. Increase in the blood space, breathing space, so pleural cavity is going to expand. Flat diaphragm. This is the lung. Heart is going to be compressed, so obstructive type of this, and compressive cardiogenic shock, hypotension होगा. Management of tension pneumothorax is tube thoracotomy done in the fifth intercostal space via triangle of safety. Um, Emergency management is needle thoracotomy. It is done in the fifth intercostal space again via triangle of safety. In children, it has to be done along the second intercostal space in the mid-axillary, mid-clavicular line. Triangle of safety is formed by, this is the axilla. You will have mid-axillary line here. This is the nipple. This is the pectoralis major muscle. Okay. Open pneumothorax. Open pneumothorax is also called as the sucking chest wound. Full thickness injury to both the pleura in communication with the external surface. As a result, atmospheric pressure is high, pressure in the lung is low, so it will be a type of sucking chest wound. PA is equal to PL, so respiration is going to stop. Management is emergency management. You are going to do dressing with taping on 3 sides. Definition management is urgent to open the thoracotomy followed by repair. Flail chest. Now, fracture of 2 or more consecutive ribs at 2 or more places. Most common fracture ribs in CPR are 3, 4, 5. In cervical spine injury, it has to be 1 and 2. Flail segment is going to show paradoxical movement, therefore it is stretching of the intercostal nerves. There is extreme pain and there is compensatory decrease in the rib cage movement. It leads to impaired ventilation and causes VP mismatch. Impaired ventilation and also ventilation perfusion mismatch. Treatment is, the first treatment of choice is NSAIDs plus minus. NSAIDs and plus minus positive pressure ventilation. NSAIDs and positive pressure ventilation. Flail chest with underlying pulmonary injury is what? Thoracotomy followed by repair. Cardiac tamponade. It is hemopericardium leading to compressive cardiogenic shock. Okay. कार्डियक टेम्पोनाड में हीमोपेरिकार्डियम है, इससे compressive cardiogenic shock होगा. Approximately 100 to less than 100 ml of blood is sufficient to cause this cardiac tamponade. It is more commonly associated with penetrating injury. Pericardium, endocardium, it is thick, inelastic, compressive cardiogenic shock. CVP, raise CVP or decrease in the CO. CO is, that is, the cardiac output is low. So you will have Beck's-Triad is hypotension, muffled heart sound, engorged neck veins. In this, the cardiac output will be less cardiac output. Okay, cardiac output is going to decrease and CVP is going to increase. USG guided pericardiocentesis is done by spinal needle of 25 gauge, 45-degree angle from the Ziphi sternum, thoracotomy followed by repair. Massive hemothorax criteria is what? The criteria of massive hemothorax is 1500 ml blood in adults on more than 25% of the blood volume in children. Most common cause is what? Ruptured intercostal vessels is the most common cause. 1500 ml blood in adults and 25% of blood volume in children. Most common cause is ruptured intercostal vessels. Hemothorax, pneumothorax and hydropneumothorax. In तीनों cases में thoracotomy is done. Fifth intercostal base by triangle of safety. Ruptured intercostal vessels is the most common cause. Massive hemothorax, initial true का drainage output more than 1000 ml in penetrating and 1500 ml in blunt trauma, more than 200 ml per hour in drain output for more than 3 hours. Okay. Caked hemothorax is a criteria for failed thoracotomies. Diaphragm का trauma, penetrating या blunt. Penetrating is the most common, associated with at or below fifth intercostal space. Blunt trauma is associated with fracture of the ribs, spine, pelvic fracture, compression fracture of the pelvis. Left posterolateral is the most common site for spontaneous rupture of the diaphragm. So postero and left side का posterolateral side. Investigation of choice is diagnostic laparotomy. Okay, it is both diagnostic as well as therapeutic. On CT, a collar sign is diagnostic. So diagnostic laparotomy is the investigation of choice. Okay, on CT you are going to see collar sign. What is the management? All diaphragmatic injuries need to be repaired and they have to be repaired by abdominal approach. Now moving on to abdominal trauma, but my battery is going to die and there is no power, so I'm going to stop the stream here. Thank you. Goodbye.